Measured as devastating and serious, the funding cuts by Trump's Emergency Plan for AIDS Relief, PEPFAR, could see years of progress in HIV programs fragile to regress. Critical PEPFAR-funded community HIV services provided by organizations serving as implementation partners are the hardest hit. Despite funding cuts coupled with an evolving donor funding landscape, health impact organization the Aurum Institute in South Africa is significantly stripped of the PEPFAR-funded resources, however, remains steadfast.
It is devastating, but it's also serious that the kind of services that we were providing in the Northwest provinces, in 3 of the districts of the Northwest provinces, we cannot continue with them because of the funding cuts.
Meanwhile, the funding cuts also brought some HIV research studies to a screeching halt.
The funding cuts also affected research. The quality research in clinical sciences and in implementation research that we are conducting at Aurum was curtailed dramatically. Although there are positive elements like the approval of the laboratory where we are in terms of international standards and the local standards, we still have need more money to be able to do TB research and to do HIV research.
The cutback on funding has sharpened global interest on the future of sustainable financing for HIV and the impact on communities across the world. Ahead of the opening ceremony taking place in Rio de Janeiro, Brazil tonight, new revelations shedding light on the real-world impact of the funding cuts has been released. The PEPFAR Pulse study surveyed the organizations that deliver PEPFAR programs and provides the first large-scale survey on the scope of PEPFAR disruptions globally.
Our first key finding is that implementing partners and their programming were hit from 2 directions. Some awards were terminated, while others were allowed to continue, but still required to alter programming to align with the priorities of this U.S. administration. More than half, 52%, lost at least 1 award outright. Those terminations contributed to the closure of more than 1,700 clinics, drop-in centers, and other service delivery sites among our respondents. These losses fell hardest on locally based organizations.
The 26th International AIDS Conference 2026 will present an opportunity for global dialogues on funding prospects in the global response to HIV.
It is significant for Aurum and other non-governmental organizations to participate in the International AIDS Conference. We want to know about how the rest of the world is coping with the funding cuts. The funding cuts did not only affect countries, also affected the World Health Organization and also affected the UNAIDS. So we want to know how other people are coping with the reduced funding. Although South Africa as a country is contributing domestically now 70% of the HIV funding, it is not nearly enough to cover also the non-governmental sector that requires to provide services, HIV delivery services to massive numbers of people in this country.
Whilst the contentious issue of funding cuts is set to dominate talks at the conference, scaling up predictable domestic funding for HIV programs could see countries move closer to achieving the global goal of ending AIDS as a public health threat by 2030. Zandile Myeza, SABC News, Rio de Janeiro, Brazil.